Rashtrottana Hospital is not only a hospital for treatment of our illness, but it is also a temple for our well-being and better living. And it's when we visit any other hospital, we talk only about the doctors. But here in Rashtrottana Hospital, it's all the way from the entrance. You see the securities, reception, front desk, lab technicians, sisters, nurses, pharmacists, and many other people you come across. They all work and they are very, very highly professional, and they work with great empathy actually. And Rashtrottana Hospital is also a stress reliever for getting treated for all our loved ones. And I came here with my 84 years old father, who was suffering with the lack of oxygen, low saturation, with high lung infection. And all I did was just came here to Rashtrottana, got him admitted, and I saw him getting better and better from the day one. And I'm very thankful to Dr. Vinod Kolla, great pulmonologist, who treated my father with so caring. And he is not only a doctor, and he has a magic hands when it comes down to treating his patients. And he has not only treated my father of 84, he has also treated my mother of 78, who was she was diagnosed with H1N1 few years back. And I am very, very grateful to all the staff, all the crew members of Rashtrottana, and very thankful to my doctor, Mr. Vinod Kolla, pulmonologist, who helped me treating my family actually. Thank you.
Hello, I am Dr. Kolla Vinod, consultant pulmonologist, Rashtrottana Hospital, Rajarajeshwari Nagar. So this case was a challenging case, as the patient, who was 84 years old, presented to the emergency with a saturation of less than 70% on room air, requiring more than 15 liters of oxygen, and in spite of giving 15 liters of oxygen, his saturation was not going beyond 90%. So we had to, and there was one more challenge, that the attenders did not give consent for intubation. So we had to immediately put him on HFNC and put him on prone positioning. And his initial inflammatory parameters were very high. CRP was very high, more than 180. And his HRCT showed bilateral multilobar infiltrates. So it was typically a viral pneumonia. We had to find out the cause and treat the same. And it was ultimately diagnosed as influenza A pneumonia. And as you must have seen, the attenders speak about his father. He is a happy man now. His father is getting discharged today. They're very happy. So just giving you a brief discussion on influenza A pneumonia or influenza pneumonia, which is commonly known as the flu. It is a viral infection which usually affects the nose, throat, bronchi, and sometimes the lungs. The common symptoms are sore throat, rhinitis, cough, and fever. So there are three types of influenza viruses: influenza A, B, and C. Influenza A and B have two surface antigens, H antigen and the N antigen. The H antigen is responsible for attachment of the virus to the susceptible cells, and N antigen is responsible for release of the virus from the cells. The influenza virus is usually typically found in animals and birds like swine, dogs, cats, horses, and domestic poultry. The usual source of infection is a case or subclinical case, that is, a person who is infected with the influenza virus. The virus is present in the nasopharyngeal secretions and it spreads to other people when he sneezes or coughs. Now, coming to development of the influenza infection, what factors lead to development of influenza infection? Especially the elderly are more prone. Those who are malnourished, those who are on immunocompromised drugs, malignancy, comorbid conditions like diabetes, hypertension, pregnant individuals. Seasonal factors also play a role, especially in the rainy and winter season. And overcrowding lead to enhancement of spread of viral infection. Now, we diagnose this case usually by a throat swab, and sometimes the radiological HRCT features show a crazy paving pattern. Coming to treatment, we usually treat this infection by an antiviral drug, oseltamivir, but sometimes it may lead to complications when the treatment is delayed, like respiratory failure requiring oxygen therapy, development of pneumonia, where a bronchoscopy may be required to rule out any secondary bacterial invasion, and sometimes ARDS or acute respiratory distress syndrome, where the patient will have to undergo ventilatory management. So the virus, when it attaches itself to the trachea and bronchi, it leads to necrosis and destruction of the epithelium, which causes secondary bacterial invasion in a few patients. So that is why early treatment is a better solution than to let the patient go into complications. Coming to prevention of influenza, we can give flu vaccination, especially for the elderly and immunocompromised and malnourished children. And for pregnant individuals, it is better to give vaccination in the second trimester. Thank you.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.